Good afternoon, and welcome everyone to the Institute of Medicine of Chicago's annual meeting. We're delighted you are with us today. I'm Cheryl Rucker-Whitaker. I'm the president and chair of the Institute of Medicine of Chicago and CEO of Complete Care Management Partners. It's my pleasure to welcome you today and to share with you the agenda for today's virtual convening. We will begin with our business meeting, and then we will open the annual meeting at 12:30 p.m. It's been a very busy year here at the IOMC, and undoubtedly for your team and your organizations and all of us. We're pleased that you can join us for a few minutes, and we'll move forward expeditiously here. The business meeting agenda includes the election results, special thanks to our Board of Governors and committees, and this will be followed by a short Q&A period. We plan to convene that by 12:30 and start the public part of the annual meeting. Over the past year, our focus was to create collaborative systemic change in the time of a pandemic through discussions, through connecting our members, connecting members of the public health and science public to create a forum for thought leadership, thoughtful and meaningful dialogue between all of us. We addressed many topics in our ongoing sessions involved with SOHOC 2020 that went into 2021, paying close attention to the social determinants of health, the health inequities that we already knew about that were exacerbated by the COVID-19 pandemic, opportunities for leadership, and then starting to identify some of the systemic changes that are needed to better support our communities who will be in a recovery for many years to come. The Institute of Medicine of Chicago is challenging itself and encouraging others through our We Can Do Better focus. So healthcare access continues to be a major problem and opportunity though. We know that we had extraordinary loss of jobs through the business shutdowns, which made all of the disparities become more apparent to us. We know that people did not go to the doctor for fear of COVID-19, also may have been fearful of the cost of care. We know that these types of disparities and these types of occurrences were exacerbated in communities of color and poor communities. In Illinois, 5.3% of the 65 plus population reported that they did not go to the doctor because of a concern about high cost. Parents certainly had a challenging year with their children being home and having to be homeschooled while they were working or attending work on video. Studies from the National Low-Income Housing Coalition show us that many people living in fear of being evicted from their apartments in the next 2 months. This will undoubtedly have an impact on healthcare. And that's what here at the IOMC we do care about. The Board of Governors has worked really diligently, and I really appreciate each and every one of them, to revitalize and push the organization forward over the past 12 months to be responsive to the current needs. This has been a huge task, because we've not been able to meet in person. We've done all of this over video. The Board of Governors are a volunteer group of leaders, and we realize that their daily professional lives are full, but yet we've been able to make great progress with our virtual convening and partnership. We plan to continue to discuss solutions to problems that we've identified from our convenings and create strong mission-directed organization focused on outcomes and encouraging collaboration between coalitions, agencies, and leaders. Successful efforts this year include updated operations to reflect current practices and hopefully bring more benefit to our members over time. We actually have now partnered with Hectone as an important sort of back office partners to support us in sort of administering our finances. We did bring on full-time administrative support arm called Golden. Delighted that they really helped produce this today. So they're really bringing us forward. We're really appreciative of that. We launched the SOHOC 2020 in September, and those sessions are planned and continuing through December of 2021. Over the last 6, 7, 9 months, we've conducted 15 virtual sessions, engaged with over 35 speakers to date, and over 900 people have attended these convenings. We have 4 to 5 sessions planned already from September to December, and at that time, we plan to summarize our efforts and identify recommendations for moving forward in Chicago. The current term is to disrupt disparities. However, we want to do more. We've created an online video library to deliver relevant information from numerous points of authority who have shared their ideas with us. This is available to you 24/7. We encourage you to go to our website to watch and listen to the recorded sessions and think about how you can be involved in creating solutions for systemic change. All of our sessions are accredited with CME, continuing medical education credits, continuing nursing education credits, and continuing education credits to bring our members more value. We published a quarterly e-newsletter and offer content that we hope that you believe is relevant, and we'll continue to develop a more scholarly focus on making a difference and positive impact in public health, healthcare, and population health. We've expanded our engagement with counties in the state of Illinois, and you will hear more about those ideas and plans for growth over the coming year. We are completing the research on the Wellbeing Trust Grant that started in 2019. More news on these issues to come forward as we complete the 8th convening of the State of Health of Chicago in the remaining months of 2021. We're also busy planning the 2022 sessions with our program committee this summer. We're committed to advancing the Institute of Medicine of Chicago and continuing its success. I want to thank the Board of Governors for the 2021 year, for their support and commitment over the past year. It's been a pleasure working with each and every one of you. I want to specifically thank Jason Kane, who will be rotating off the board after this term at the end of this annual meeting, and also Mark Shields, who will also be rotating off the board at the end of this annual meeting. So I want to thank all of you for your service and your continued service. Now I'm going to turn it over to Dr. Lorenzo Pence, the Secretary of the Institute of Medicine of Chicago, who will share the election results and the upcoming additions to the Board of Directors. Dr. Pence.
Thank you, Dr. Whitaker. It has been a pleasure working with everyone this year, the Board of Governors over the past year. It's been I think, a very great year. We've made, I think, much progress. I would say that today, and I've said that several times over the year, that I think we're at a different place, and it's very exciting. IOMC is building and adding new levels of programs, initiatives, and operational processes that offer us to grow. We have a very, very promising future. So I'm really pleased to share the election results. I want to thank everyone for participating in the election for next year's term, which is July 1st through June 30th. It's my pleasure to inform that the 2021 slate has been 100% accepted based upon the votes casted. So your officers for the 2021-2022 year are Dr. Cheryl Rucker-Whitaker will continue as president and chair of IOMC. She is the CEO and president of Complete Care Management Partners, LLC. She's a Billings Society fellow and a member since 2017. Mr. Garza will continue as vice president. He's the CEO and president of Aunt Martha's Health and Wellness. He is a Billings fellow and a member since 2019. Mr. Richard Ferrero will continue as treasurer. Rick is a CPA and the principal of Ferrero Healthcare Advisory Group. And he's also a Billings fellow and has been a member since 2019. I will continue as secretary. I'm the senior vice president for osteopathic accreditation at the ACGME. I'm a Billings fellow since 2015. We've elected 2 new directors to the Board of Governors. We want to congratulate Dr. Noreen Miller, was elected as director of the Board of Governors. Dr. Miller practices internal medicine, is an associate professor of medicine, and is director of medicine for community health and vitality, University of Chicago. And she is a regular fellow and a member since 2021. And we have Dr. Marcus Lemon, was elected as director of the Board of Governors. Dr. Lemon was with the Health Management Associates Incorporated and continues to work with the underserved population. He's a billing fellow since 2017. So please join me in welcoming all these leaders to our board. And again, I want to thank everyone for their support and thanks for participating in the election. And we look forward to a wonderful 2021-22 year. I would like to now introduce Mr. Garza, Vice President. your vice president, he will share and provide comments about our committees. Mr. Gardner.
Thank you, Dr. Pence, and good afternoon, everyone. As Dr. Rucker-Whitaker stated, it's been a remarkably busy and very challenging year. The members of the Board of Governors have been fortunate to work directly with so many of you this year, but we are especially grateful for the efforts of those who served as our committee chairs during the past year, and I just want to take a minute to say a little more about that. Each of the Institute's 9 committees represents an opportunity for our members to contribute. And I would really like to encourage all of our members to explore those opportunities. There's no shortage of opportunities and we can really use your help. These committees are at the center of the action that is driving the Institute forward and will continue to do so. Over the last 12 months, it has been my pleasure to serve as the chair of the Communications and Marketing Committee. Today, I'm pleased to introduce and thank my fellow committee chairs, including Mark Shields, who chaired our Advancement Committee, Pat Merriweather, who co-chaired the Awards Committee along with Dr. Rucker-Whitaker. Pat and Dr. Whitaker also co-chaired the Program Committee. So absolutely a lot of work going on there. My good colleague, Richard Ferraro, chaired the Finance Committee. Les Sandlow, who chaired our Membership Committee. And then Nellie Vasquez-Rowland and Kathy Damu, who co-chaired the Nominations Committee at the IOMC. And then finally, Mark Grosh, who chaired our Planned Giving Committee. So many thanks go to these 8 individuals, but also to all of you who made the commitment to serve and then followed through on it. We are growing, not just in membership, but in our mindset as well. I encourage you to find a way to be more involved. I encourage your colleagues to be more involved. And as I said, the leaders and the members of those committees are the people who will drive the work ahead. We are excited about where the Institute of Medicine of Chicago is going, and certainly we can get there faster with your help. Thank you.
Thank you. And thank you, Raul. At this time, I'd like to open up the meeting for questions. You can use the chat box. When we used to get together in person, this was an open time for us to sort of share with each other and make suggestions about what you'd like to see. I just want to share with you a couple of the comments that I received, and then if you have others, please put them in the chat box. One of the members' requests, and this came up several times, is particularly after the State of Health of Chicago convening in October, where we looked at complex topics like wealth and health. We looked at maternal morbidity in specific areas of the city. You were interested in us convening work groups on these topics of interest so that people from across the city could work together to identify opportunities to close some of these disparities gaps in these areas. Some of the topics people were interested in were maternal and child health, safety and quality, COVID-19 recovery and disparities, and the opioid crisis. So that was one of the suggestions that we received. The outcomes of such convenings could be, or work groups could be, a white paper with recommendations to state, city, and other local leaders. Another recommendation that I received was partnership with a club or other that would allow kind of a central or consistent location to facilitate regular, small kind of cocktail hours with topics to allow for member exchanges sort of more casually. Those are some of the suggestions that I received. Are there any other ideas or are there any questions from the floor at this time from members? Okay, hearing none, that means we did everything right and nothing wrong, and you all love everything we did, and you don't want to change a thing. Okay, so please do, guys. I'm joking, but we want to hear from you. I think if we could get some of the things done that you suggest here, even so, we could be on our way. So we will look forward to next year. We're going to ideate a bit in July about how to lift up some of these efforts that you mentioned. And then also I need feedback from the members about when and how you want to come back in person. So I want to hear more about that. Do you like virtual programs? Do you want to be in person? We're looking to December to be in person. So we'd like to hear from you guys about that. So please feel free to be engaged with us and help us kind of figure out the next path to go. Are there any other comments or suggestions? If not, I'll take a motion to adjourn our business meeting.
I'll make the motion, Madam Chair.
Motion from Raul
I'll
Garza,
second it. I'll second.
a second from Lorenzo Pence. Is there a motion and second that we can adjourn this meeting? Thank you very much. Everybody stay on. We will begin the annual meeting and IOMC awards at 12:30. Is there any harm to, so it looks like we need to begin at 12:30. I'll ask you to, I believe, just go on pause and rejoin us in, looks like 13 minutes. Thank you. Good afternoon, good afternoon. We just convened our business meeting. If we were in person, we would have been chatting among ourselves and then coming back to order. So on behalf of your 2021 Board of Governors, I want to welcome you to the 2021 annual meeting. Holding this meeting virtually is a little bit different for us, but we're still happy to come together today as a part of our tradition. I'd like to share the agenda for today's convening. We're going to recognize our supporters and sponsors. We'll announce new regular fellows and recognize our Billing Society fellows. This will be followed by the presentation of the awards and a few announcements, and then time at the end for a brief session to share comments from the attendees. Let us remember that the Institute of Medicine is an independent organization of distinguished leaders in the healthcare field who work to collaborate together to improve the health of the public. We draw upon the diverse expertise of our membership and other regional leaders and seek to address critical issues through a range of interdisciplinary approaches, including just informing and talking to one another about things that are already occurring that could be improved, continue to provide trusted information and communication of such, and engaging our communities as we move about. Remember that the Institute of Medicine of Chicago was important to recognize our history by three prominent physicians with the vision of improving the health of Chicago and health of the public in 1915. We are a 106-year-old organization. Doctors Billings, Hectone, and Dr. Pussy launched the organization at that time. The history of the organization is characterized by many important milestones over the years, including efforts to work together to control tuberculosis, improving the standardization of autopsies, advocating for public ambulance service in 1945, allowing African-American physicians to join medical staffs of hospitals so that their patients could be admitted to the hospital in 1954, and then working to outlaw fee splitting and kickbacks with a change in the Medical Practice Act in 1971. So from research to practice changes, the Institute of Medicine of Chicago has worked with other leaders to take on disparities in many different ways. In 2004, we convened our first conference to eliminate health disparities in Chicago and created a call to action. And we've been focused on the social determinants of health for the past several years. Today, we're leaders who work with and for our communities with a focus and an interest on improving the health of the public. And we recognize that because of this recent pandemic, we've realized and recognized opportunities to improve that network and to really solidify and put greater focus on our mission. At this time, I would like to introduce you to Dr. Mark Shields. Dr. Mark Shields is a member of the Board of Governors who will share with you the good news of our supporters. Mark has chaired the Advancement Committee over the last 2 years, but in addition has provided extraordinary service to the Board of Governors over the years. We appreciate his efforts and look forward to hearing from him at this time. Dr. Shields.
Well, thank you very much, Cheryl. I know that you've already gone through during this meeting, and then you went through in some more detail at our business meeting, the many programs that IOMC is doing and has accomplished over this last year and is planning for the upcoming year. And I think it's important that that all our fellows understand that dues are just not adequate for us to fully take on all of these aggressive programs. And I'm hoping that our fellows will participate following the lead of the board. 100% of our board has participated by advancing to the Billings Society membership level, which is expanded dues from the standard dues membership, or to consider and/or considering making a contribution. So you're seeing on the screen here our annual donors, and I think we have a screen also of our Billing Society fellows. So I just encourage you to join and help support this aggressive program with a contribution or advancing to Billings fellowship level. So thank you very much, Cheryl.
Thank you, Dr. Shields. And next slide, Deborah, I think we have, want to recognize our sponsors. Blue Cross Blue Shield of Illinois, Northwestern Medicine, Rosalind Franklin University, the University of Chicago Medicine, the Portis Foundation, the Michael Reese Research and Education Foundation, the Washington Square Health Foundation, the Hectone Institute, Complete Care, Aunt Martha's Health and Wellness, Care Advisors, and Golden Square, not Golden Door. Thank you, Golden Square. At this time, I would like to introduce Dr. Lorenzo Pence to recognize the Billing Society Fellows. Dr. Pence.
Thank you, Dr. Whitaker and Dr. Shields. We are so thankful for the wonderful support of the many wonderful individuals and all these organizations. Again, thank you. As a member of the membership committee, I'm pleased to recognize the Billing Society Fellows. They are the highest level of membership within the IOMC. These individuals are relentless in their dedication to the healthcare and public health of the Chicago area, but certainly nationally as well. They have elevated the support to the Institute of Medicine, and that's apparent, I think, each and every day. And again, I want to thank everyone that has participated, that certainly has supported the Institute. Please, these are our Billings Society Fellows. Please, I'd like everybody to certainly recognize them and again, thank them for all their support. We couldn't do the things that we do without all of them. And again, we really appreciate that. And certainly you can refer to the slide that gives you all the various names of the Billings Society Fellows. And now I would like to introduce Mr. Gaza, who will introduce the new regular fellows that are just now coming on to the Institute of Medicine Chicago.
Once again, thank you, Dr. Pence. It certainly is my honor and pleasure to introduce the individuals who have been awarded the distinction of regular fellow during the past year. And those individuals are Dr. Ellison Erwadi, Dr. Donald Chambers, Dr. Matthew M. Davis, Dr. Fernando De Mayo, Dr. Ngaze Ezike, Dr. Earl Frederick, Ms. Dawn Gay, Dr. Helene Gale, Ms. Darlene Oliver Hightower, Dr. Kiran Joshi, Dr. Jerry A. Krishnan, Dr. Tamara Kanzeka, Ms. Fawn Lopez, Dr. Dorian C. Miller, Dr. Mildred M.G. Oliver, Ms. Nancy Parsley, Mr. Mark Pfister, Ms. Bina Peters, Ms. Rachel Rubin, Ms. Rachel Rubin, Dr. Melissa Andrea Simon, Mr. Scott Tomar, and Ms. Stephanie Wilding. Congratulations to each of you. Now I'd like to introduce a gentleman who has been a dedicated and very active member of the IOMC for a good number of years. This past year, he served as the chair of our membership committee, help me to welcome Dr. Les Sanlow. I know he would like to say a few words to the fellows who were just introduced. Thank you.
Thank you very much, Raul. My comments will be very brief. One, I want to congratulate all of you for coming in as fellows. And with it, of course, comes some major responsibilities. You've heard about trying to help and work with us in the various roles that we've taken on, as well as support. But I have another. You want to make my committee very active. And to make the committee very active, we need nominations of individuals in the health care related fields that are eligible either as regular fellows or as associate fellows. And we have criteria to deal with both. The fact is, we want to expand to the community and get everybody involved. And to do that, we need nominations. And so my charge to all of our new fellows is find us those to nominate who are eligible for fellowship. And again, congratulations.
Thank you, Dr. Sandlow. And thank you for your service and support of the work of the membership committee and as many other things this year. I really appreciate your tutelage and your mentorship. At this time, I'd like to begin the awards presentation to our distinguished guest. We are pleased to present awards today for the Lifetime Achievement Award and a special award from the Institute this year in recognition of the COVID-19 pandemic, the Public Service Award. We're going to now have Dr. Sandlow lead us in awarding the Lifetime Achievement Award. Dr. Sandlow.
Thank you. This is one that gives me really great pleasure and an honor that I was asked to actually do the intro. I want to introduce you to Mark Shields. You've already had a chance to see some of his actual activities, but this is now to look at what he's done over the years to be the Institute of Medicine of Chicago Lifetime Achievement Award recipient. We're really honored to do it. He's been a fellow of IOMC for over 20 years, and he served on the board of governors since 2013. It's a shame that our rules are that he has to go off for the moment, but I'm sure that we'll all be busy keeping him very close to get him back on as soon as he's eligible. Recently, as you see from the earlier meeting, Mark has been the chair of the Advancement Committee, as well as a member of the Plan Giving Committee as a couple of his activities. I will tell you that if you look at the donations and sponsors that have come up, you can get a good example of how hard he has worked at helping everybody generate those dollars. At the same time, he's been an integral member of the Wellbeing Trust grant research, which has been an issue that's come up over time in trying to deal with the entire concern of well-being. And in addition, he's been a member of the Management Implementation Committee since 2019. He obtained his MD from Harvard and did his residency at the late Michael Reese Hospital and Medical Center. That's where I first met Mark, as I was affiliated in many leadership roles at Michael Reese. He finished his residency in internal medicine and then was the chief resident, already getting involved in more than just patient care, but in healthcare management. He went on at that time, I remember very clearly, he announced one day when he was in my office that he was going to do an MBA and had been accepted at the business school at the University of Chicago. Not only did he do that MBA, but he did some interesting and worthwhile research in healthcare delivery at that time. In addition, he's certified by the American Board of Internal Medicine as well as being a diplomat in internal medicine and geriatrics. His dedication to healthcare is obviously well known. He's been a speaker all over the country, and he was honored in 2012 in the Hospital and Health System Leaders to Know by the Becker Hospital Review. This is an honor given to leaders who've shown dedication to the improvement of healthcare at regional, local, as well as national levels. He's mainly interested these days and committed to addressing the social determinants of health, and probably has done more for convincing me that although it's nice to say that's somebody else's responsibility, it is part of healthcare, and so it's our responsibility. He exhibits endless commitment to healthcare, has a great eye, extraordinary for detail, drives me crazy because I like to look at it in a broader sense, and he gets into the nitty-gritty and really pushes to get it done. He has a long record of accomplishments, both as a practicing physician, an author, and a medical manager, and has a vast network now of colleagues in the fields. And he's been, in my coming back to the Institute, one of those that was a driving force. Mark practiced general internal medicine for the first half of his career, and I think maybe continued, I'm not sure, but got involved much more in the areas of medical management. In reality, if you don't count being chief resident, his first real paid position was as associate medical director of the Michael Reese Health Plan, which then was taken over, of course, by Humana. Following that, he ended up over all these years as the senior medical director for Advocate Physician Partners and the vice president for medical management of Advocate Healthcare. And now is the executive vice president of Shields Consulting. The important thing to note is that between that first position and his current activity, he continuously held areas of responsibility in leadership that progressed until now. He's been affiliated with Advocate Lutheran General since 2002, and before that was at Michael Reese and some of the more local hospitals. What is amazing that with all the things he's been doing, I once recruited him to run a small group of medical students in an interactive program at the University of Illinois. That was years ago. I won't even tell you how many, but what's amazing is he's still doing it. And he's an adjunct assistant professor since 2004. Has had academic appointments, of course, at various other schools when he was at those places. He's published many articles. He's a reviewer for the Annals of Internal Medicine, as well as for Health Affairs. And his role as a national leader is exemplified by all of that. But again, another place I have to mention, I was a founder of an organization called Alliance of Independent Academic Medical Centers. It was the large medical centers of the country that were not run by the universities. And lo and behold, he became a board member. And in 2009, I think, was awarded the Ethel Weinberg Award for his major activities in the Alliance. He's also, of course, a fellow of the American College of Physicians, American College of Physician Executives, and a whole host of others that I won't bother noting. On a personal note, after all that, I have to say, it's not only been a great pleasure, but an honor to know and work with Mark over the past 45 years. And in closing, the Institute of Medicine of Chicago is very proud to honor Dr. Mark Shields with this lifetime award and recognizing his career and dedication. Thank you, Mark.
Well, Les, I don't know if I can say much after what you said. You're very kind. You're very generous. I am very appreciative of this award from the Institute of Medicine of Chicago. And I will say that, Les, you were one of the key people to get me interested in the Institute of Medicine of Chicago, and has really been an inspiration to me since my internship days at Michael Reese. So it's kind of a personal closing the loop of having you giving me this award. So I greatly appreciate it. So thank you very much to IOMC and to you personally, Les.
Thank you, Mark, and congratulations again. If we were together, we'd be clapping and giving you a standing ovation. But I know I've been extremely appreciative of your commitment and leading by example at the Institute of Medicine of Chicago. So we look forward to you staying in touch, and again, really appreciate all that you've done and all that you'll still be doing for the Institute. Now we have the wonderful opportunity to present a special award for public service. We created the award this year for our public health leaders who've exemplified a leadership under very trying times. You know, people like Dr. Owati prepare for disasters and pandemics. I'm not sure if she ever thought it would come right to her feet here in our own country in Chicago, as an example. However, these leaders led with really grace, elegance under extraordinary pressure. They were driven to collaborate because county lines didn't mean anything to COVID-19, and they all recognize this. And we're coming through it, but with great leadership. And we want to recognize that today. On behalf of the Institute of Chicago, I am pleased to honor the following individuals with the Special Award in Public Service for 2021. And if you'd like to speak for maybe about 30 seconds, we're happy to hear from you. Karen Ayala, Executive Director of DuPage County Health Department. Congratulations, Karen.
Thank you so much. It has been just an incredible year, and without the partnership of the other individuals who are receiving this recognition today, it would have been even a lot more difficult. So thank you so much.
And thank you for joining us today, and thank you for your service. Our next awardee for the Special Award in Public Service, Barbara Jeffers, Executive Director of Kane County Health Department. Accepting from Ms. Jeffers is Uche Unwutu. Congratulations to Ms. Barbara Jeffers.
Thank you. Good afternoon. It's my honor and pleasure to accept this award on behalf of Barbara Jeffers. Barb was a diligent, passionate, and dedicated public health professional, a visionary and dependable and innovative leader. She steered the ship of King County Health Department through these turbulent times. She has retired as of December 20th, and she's very pleased to receive this award. Thank you so much.
Thank you very much. Melissa Adamson, Public Health Administrator of McHenry County Department of Public Health. Congratulations, Melissa. Are you with us?
I am. Can you hear me?
Yes, ma'am.
Yes, so I'm honored to be with you today and grateful for the recognition, and so proud to be working alongside such a committed group of public health professionals. And I think our successes to date are a direct reflection of our dedicated staff who've demonstrated such hard work and resilience over the last 15 months. And I echo what Karen said, that I also want to give my sincere thanks and appreciation to my colleagues across the region for their support and guidance through this response. I think that has been such something that can't be understated in terms of having that support. So thank you very much.
Thank you. Mark Pfister, Executive Director of the Lake County Health Department and Community Health Center. Congratulations, Mark.
Thank you so much, and it's a pleasure being back here at IOM. I did have the pleasure of giving a presentation with a few of my other colleagues to IOM. And so I just want to say thank you all for this, and certainly healthcare, we as directors of health departments certainly have a common bond, but I also want to thank all the other medical professionals that assisted us during this event, the hospitals, other medical providers. So again, we are all under one roof. We are all part of the public health system. So we thank you all for everything that you assisted us with also. Thank you.
Thank you. Susan Olenek, Executive Director of the Will County Health Department. Congratulations, Susan.
Thank you. Thank you, President Rucker Whitaker and the board. And thank you, IOMC, for everything that you do and the members that provide so many services to the Chicagoland community. It's very appreciative. I can't express how appreciative I am of being in the same category with the other individuals that are getting this award today. We have developed an even closer collaboration. And I think overall, as Mark said, we've also developed much more of a collaboration, a tighter collaboration with the rest of the public health and healthcare system. So I appreciate this today. We still have a lot of work to do, and thank you very much for the award.
And thank you. And thank all of our health directors from the kind of collar counties of Cook, if you will. We felt it really important to make sure that we recognized you because we realized how much collaboration needed to happen when a pandemic doesn't have county lines, right? We really have to bring the best of us together. So we're super appreciative. Now for the next special award in public service, we'd like to recognize our leaders from the Cook County Department of Public Health. Cook County is one of the largest counties in our country. And these two had quite a bit to bite off. And so today we want to recognize them. Dr. Kiran Joshi, Senior Medical Officer and Co-Leader, Cook County Department of Health, and Dr. Rachel Rubin, Senior Medical Health Public Officer and Co-Leader of the Cook County Department of Public Health. Dr. Joshi, are you with us?
I am. Thank you so much, President Rucker Whitaker. Thank you, IOMC, for this thoughtful and really meaningful award. As per my colleagues' comments, I feel really honored to be in such amazing company. All the individuals that are being honored today have served as not only peers that I could go to with questions, but confidants, and at times, dare I say, therapists. But most importantly, in my view, these people are heroes. They're heroes of public health, and they are the reason that our society is able to open up in the ways that it is today. And I'm hopeful that that trend will continue. Thank you again to IOMC. Thank you to all my peers. And lastly, I want to say and acknowledge the staff who work for all of us and have done just such amazing work under incredibly challenging circumstances. Thank you.
Thank you, Dr. Joshi. Dr. Rubin?
Yes, thank you so much also for this tremendous honor. I echo my partner's comments and also the other awardees that we couldn't be doing this work without our staff and our community partners. So I want to give especially a big shout out to all of our community partners that have also stood up to help us in this fight against COVID. And I want to accept this award on behalf of our staffs as well as our community organizations and partners that have been at the forefront with us. Thank you so much.
And thank you, Dr. Rubin. I know that you lost your dad in this COVID-19 era, so we want to express our condolences as well to you.
Yeah, thank you. It was actually both my parents, and it's I appreciate the condolences, and it's what in addition to being a public health professional, obviously makes this that much more personal and pushes me on to continue this work. So thank you.
Thank you, Dr. Rubin. And for the next special award in public service, we want to recognize kind of our own commissioner of the Chicago Department of Public Health, Dr. Allison Awadi. We know that Dr. Awadi is, as with all of your colleagues, working kind of overnight, all day long, all night long, over the last year. We hope that you're coming up on some honestly well-deserved vacation time, but we absolutely want to thank you today and for all of your work to bring Chicago sort of back on the map and really represented in the COVID recovery. So Dr. Awadi.
Thank you so much, President, and really thank you to all of IOMC. Public health is a team sport, and you know the co-awardees that we've heard from today, we have all been on texting and calls and really trying to do what we can as a region and try to think collectively about how to be as aligned as possible, really have a data-driven response. And I really want to thank many members of IOM who have reached out with ideas, with suggestions, with thoughts about how we could do things more effectively. We really want all of us, I know, to take some of these lessons that we've learned from COVID, recognize the critical role that public health plays, and then make sure we can be as aligned as possible with the healthcare system. So thank you for everything you have all done and continue to do and will continue to do, because COVID's not over. And so on behalf of all of my staff and really public health colleagues, we really appreciate the acknowledgement.
Thank you, Dr. Awadi. Thank you for your service. And the final award, special award for public health service, goes to Dr. Ngozi Ezike. Dr. Ezike is the Director of Public Health for the state of Illinois. Was Dr. Ezike able to make it with us today? We would expect that she was very busy, so wasn't quite sure she'd make it. But we will be passing on, as we already have, this recognition. But we do know that she's really served with great commitment, dedication, and esteem throughout this very complicated time in the life of public health and of the public. So I want to, on behalf of the Institute of Medicine of Chicago and the Board of Governors, thank Dr. Ezike, and I want to thank every single one of our awardees for their service. We're going to move to our next portion, and we're wrapping up here, so we thank you for your patience. Dr. Sandlow, would you like to share a few words about the upcoming Portis Foundation call for letter of intent right now? Is Dr. Sandlow available to speak?
It would be my pleasure. The Portis Foundation, in association with the Institute of Medicine of Chicago, is, as it does every year, soliciting proposals for research projects that relate to either health promotion or disease prevention. And we're looking for letters of intent at this point. We have funded proposals over the years, and if I give you a dollar amount, my concern is that everybody will go for whatever the highest number is. So I'm not going to mention dollars other than to say that it is a one-year project that we're looking for, and we will appropriately fund it if it's one that is selected. The requirements are pretty simple. The principal investigator must have a doctorate, have an appointment at either a medical school, another health science school or college, or a hospital or group practice that is affiliated with a university. In other words, if you're interested, I'm sure you'll meet the requirement. We invite anything that explores research or even implementation ideas that are effective in health promotion and disease prevention, and should basically be investigative, looking at either etiological factors, prevention, primary or secondary, and even educational programs. We look at all of them. These are letters of intent And so it's relatively brief. We're asking for not more than a 3-page letter describing what you're interested in doing. And the board then will review them and select those that it will ask for a competitive, descriptive proposal. And then finally, the proposals will get judged and something will be funded. The date for the letter of intent is, the deadline is August 1st. We invite everybody to come up with great ideas, and we would love to try to find the dollars to help fund it. Thank you.
Thank you, Dr. Fanlow. As we move to the last parts of our program, as a reminder, the Institute of Medicine is looking for an in-person December meeting opportunity. We will be monitoring and thinking about how we best approach. There are some remaining awards that will be recognized at that meeting. The Henry P. Russey Award, Citation for Exemplary Compassion in Healthcare, the IOMC Humanitarian Global Health Award, and the Innovation in Healthcare Delivery Award will be presented at that convening. We would like to share a few announcements of upcoming programs. We'll be taking a hiatus from sessions this summer to plan for the fall. Our opening session on September the 10th will be with Dr. Fernando De Mayo and Dr. Maureen Benjamins. They will be presenting topics related to their second book in a series that will be released soon, called Unequal Cities: Structural Racism and the Death Gap in America's Largest Cities. They will share their research and help us identify new ways for looking at and solving structural racism and issues related to it. We'll also have Dr. Melissa Simon speak with us on issues related to maternal and child. We have a session on cannabis and medical cannabis that will be facilitated by Dr. Melanie Dreyer, formerly the Dean of School of Nursing at Rush University Medical Center. And later in the year, we will host Andy Slavitt, who was President Biden's White House Senior Advisor for the COVID-19 response. He is the author of a book called Preventable, and it's an account of the US coronavirus response that was released in 2021. But he also has been at CMS and now is in the sort of venture space, looking at new solutions, et cetera. So we look forward to a conversation with Andy, likely in December. In 2022, we'll be hosting a hybrid program with the Rosalind Franklin University, looking at the intersectionality of education and community engagement. So look for more details soon. If you have at this time any questions or answers in the chat box, we'd be happy to entertain questions, a few questions, or share any of your thoughts with others. So please feel free to use the chat. In the meantime, I would like to congratulate all of our new fellows, our 22 new fellows, all of our awardees for the Special Award in Public Service. I'd like to thank and congratulate Dr. Mark Shields on receiving the Lifetime Achievement Award. And I'd like to welcome our new board members, Dr. Dorian Miller and Dr. Maurice Lemon, to the Institute of Medicine Chicago Board of Governors. So we look forward to really an extraordinary program year and convening year. Hope to see many of you in person. And I look forward to hearing any ideas from all of you. You can always feel free to contact IOC staff. That's, as I said, Golden Square, not Golden Door, is our administrative program administrator. IOMC staff at IOMC.org. And you, of course, can reach me as well. So feel free to reach out. Are there any questions from the floor or comments before we convene? I again want to thank each and every one of you for joining us today. I want to thank the Board of Governors for their support. And I look forward to seeing you live in the 2021 program year. Thank you so much for attending today's event. Goodbye.